Hello and welcome. Today we're diving deep into a rare, yet serious genetic disorder, Pompe disease. We'll explore its causes, effects, diagnosis, and the hope that modern medicine offers to those affected. Pompe disease isn't caused by an infection or injury, but by a faulty gene. Specifically, it's caused by mutations in the GA gene. This gene provides instructions for making an enzyme called acid alpha-glucosidase, also known as acid maltase. This enzyme is crucial for breaking down glycogen, a stored form of sugar inside the lysosomes of our cells. Now here's where things get tricky. When the GAA gene is mutated, the body either produces very little or no functional acid alpha-glucosidase enzyme. Without this enzyme, glycogen can't be properly broken down. Instead, it builds up excessively within the lysosomes, particularly in muscle cells, including the heart and skeletal muscles. This glycogen overload disrupts the normal function of these cells, leading to progressive muscle weakness and organ damage. Pompe disease is a rare condition, affecting roughly 1 in 40,000 newborns worldwide. However, some populations have a higher incidence. Because it is a genetic condition, it affects males and females equally. The diagnosis rate can vary significantly depending on awareness and access to diagnostic testing in different regions. The signs and symptoms of Pompe disease vary depending on the age of onset and the severity of the enzyme deficiency. In the infantile onset form, symptoms typically appear within the first few months of life. These can include severe muscle weakness, a floppy or ragdoll appearance, difficulty feeding and gaining weight, an enlarged heart called cardiomyopathy, and breathing difficulties. The later onset form, which can manifest in childhood, adolescence, or adulthood, presents with a slower progression of muscle weakness, often affecting the limbs and respiratory muscles. Patients might experience fatigue, difficulty walking, shortness of breath, and frequent respiratory infections. Diagnosing Pompe disease involves a combination of clinical evaluation and laboratory tests. Doctors will often start by assessing the patient's symptoms and family history. A key diagnostic test is a blood test or muscle biopsy to measure the activity of the acid alpha-glucosidase enzyme. Reduced or absent enzyme activity confirms the diagnosis. Genetic testing can also be performed to identify mutations in the GAA gene, further confirming the diagnosis and potentially providing information about the severity of the disease. Pompe disease is generally classified into two main types: infantile onset and late onset. Infantile onset Pompe disease is the more severe form, with symptoms appearing early in infancy. These infants often have significant heart involvement and typically don't survive past the first year without treatment. Late onset Pompe disease is less severe and progresses more slowly. The age of onset and the specific symptoms can vary widely among individuals with this form. While there is no cure for Pompe disease, significant advancements have been made in treatment. The primary treatment is enzyme replacement therapy, or ERT. This involves intravenously administering a manufactured version of the acid alpha-glucosidase enzyme, helping to break down the accumulated glycogen. ERT can significantly improve muscle function, heart health, and overall survival, especially when started early. In addition to ERT, supportive therapies such as physical therapy, respiratory support, and nutritional management play a crucial role in managing the symptoms and improving the quality of life for individuals with Pompe disease. As a genetic condition, Pompe disease isn't preventable in the traditional sense. However, genetic counseling is essential for families with a history of the disease. Carrier testing can identify individuals who carry a copy of the mutated GA gene, even if they don't have the disease themselves. This information allows couples to make informed decisions about family planning and understand the risk of having a child with Pompe disease. The prognosis for individuals with Pompe disease varies greatly depending on the age of onset, the severity of the enzyme deficiency, and the timeliness of diagnosis and treatment. Without treatment, infantile onset Pompe disease is often fatal within the first year. However, with enzyme replacement therapy, survival and quality of life have significantly improved. For late onset Pompe disease, the prognosis is generally better, but the disease can still lead to significant disability and reduced lifespan if left untreated. Research is ongoing to develop new and improved therapies for Pompe disease, including gene therapy approaches, which aim to correct the underlying genetic defect.